Wow, can you guys believe that 2022 is almost a wrap? I mean, the year has gone by so fast, and it's kind of scary and ridiculous how fast it went by. But I will say I am kind of ready for the new year. Kind of not, but can't stop it, so it's coming. But anyways, what I did about a week ago was I sat back, and some things that I like to do at the end of the year is kind of reflect on just a variety of things going on in life. And so one of the things that I reflected on was my YouTube channel. And this was a channel that I started back in 2020 during the pandemic because I wanted to help parents and caregivers and other therapists because I didn't have any one-on-one in-person contact with anybody really during that time. And so over the years, I just continued to put out more content and put out more videos. And I was reflecting on everything the other day. And so what I wanted to do was have a video about my most frequently asked questions when it comes to early childhood, when it comes to dealing with children who have autism or sensory processing issues, or even some questions that came in from some fellow occupational therapists. And so how this video is going to be is half of the questions I'm going to address are going to be some of the most common questions that I received from parents and caregivers over the last couple of years, and the other half is going to be some questions that I received from some fellow occupational therapists or individuals who want to get into occupational therapy. So without further ado, let's get going, and here's the first question that came in. So question number one was, can a child be a sensory seeker and a sensory avoider at the same time? And the answer to that is absolutely. So we have 8 different senses, and it's processing so much information all the time. And it is very possible for a child to seek certain types of input while avoiding other types of input. So let me give you a quick example. Some children may seek a lot of movement. These are the children that are constantly like moving on the go, can't sit still, like all over the place, bouncing off the walls. They are seeking lots of movement. But at the same time, this same child who seeks lots of movement may also avoid certain types of textures or avoid certain types of food, or may be an extremely picky eater. So in that situation, you have a child who is seeking movement, but they're also avoiding different textures. So in that case, a child can be both a sensory seeker and a sensory avoider. And there also may be some cases in which a child may seek a certain type of input one day, and the next day they may avoid that type of input. And so many different factors may influence how that child is processing that information. It could be things going on with them internally. It could be things that's going on in their environment. So some things may change on a day-to-day basis, which is sometimes rare, but it does happen. But overall, just to answer this question in a quick nutshell, yes, a child can be a seeker and an avoider. So the second most common question that I had this year or over this past couple of years was, if my child has sensory processing issues, does this mean they have autism? And this is a very popular question, and I understand why. And the reason why it's such a common question is because sometimes autism and sensory processing can overlap. So let me break it down for you. So a child that has sensory processing issues may just have sensory processing issues all on its own, right? Sometimes a child that has sensory processing issues does have autism, but it does not automatically mean that just because your child is having some type of sensory issue that they also have autism. That was a mouthful. So, but I will say on the other hand of that, which is why I understand why it could be confusing, is that majority, if not all of children that have autism do show or exhibit some type of sensory processing issue or challenge. And so that's why those two can overlap, but they can also stand on their own, if that makes sense. So I will say if your child has autism and has been officially diagnosed with autism, autism, 9 times out of 10, they may have some type of sensory issue. However, if your child has a sensory issue and they have not been diagnosed with autism, it does not automatically mean that they have autism. And if you want more information about that, I have a whole separate video where I go into lots more detail about this topic, but I just wanted to highlight that that was a very popular question that I received. So I'm definitely going to place the link to that video in the description below if you want to watch it and get more information about that. So question number 3 that I received from parents and caregivers over the years was, what's the difference between having a child that has some type of sensory processing behavior and a sensory processing disorder? Like, when does a sensory processing behavior or sensory seeking behavior turn into a disorder? And let me address that for you. So sometimes, or if not all the time, we all exhibit some type of sensory whatever it is. Some of us avoid sensory input, some of us seek sensory input, right? So I'm going to give you an example. Let's say we have a child, a young child. Let's say we have a child that's a year and a half, right? And this child loves all the sensory things in the world, right? They love movement. They love to be held up in the air. They love messy play. They love all the textures. They love strong flavors. They love music. They are just a sensory palace of they just love all the things sensory, right? This can be typically normal as a child is growing and developing and just learning about their environments. They're learning about their body. They're doing what feels good to them and what feels good for them. And so there may be children that just are sensory seekers, right? They may just crave that type of input. So when it comes and transitions into like a sensory processing disorder or something that you may want to be a little bit more concerned about is when some of those behaviors that they're exhibiting starts to impact their function and starts to impact their daily lives. So let's say you do have a child that is always on the go and they're always seeking movement. However, this behavior is now starting to impact their ability to attend to a structured activity. It's impacting their ability to complete activities. It's impacting their ability to play. It's impacting their ability to learn. It's impacting their speech and language skills. It's impacting their ability to participate in their daily routines. That is when it can be considered a sensory processing disorder because it's actually impacting and affecting their life. And it's preventing them from being able to be functional and be independent in their everyday environment. That is where sensory processing challenges can transition to a disorder. So remember, if it's just behaviors, hey, we all have some type of sensory behavior, but when that behavior starts to impact the way we live our lives, that's when it can become a disorder. All right, so my next question that was very popular was, I got so many different questions about children who are smushing their face against their parents or rubbing their head against their parents' chin or squeezing their parents' faces too tight or pulling their parents' hair or just rubbing their head against their parents' chin or cheek, something all up in here. It was a lot of that going on. And so a lot of parents was like, what does this mean? Like, why is my child always pushing their face against my face to the point where it kind of hurts? Why is my child like pushing their head against my head or putting their head underneath my shirt? Like, what is that all about? And so what that is your child may be possibly seeking what's known as more proprioceptive input. Now, proprioceptive input is basically the input that we feel to our joints and our muscles. And so sometimes when a child's system is underactive, they seek a lot more of that type of input to help them feel well, help them feel regulated. And so that's why you may see some of those children engaging in those behaviors. They may not understand how much force they're really needing or using, but they know that their body feels better when they do it. And so here are a few activities that you can try to substitute those type of behaviors. First of all, I would definitely implement social stories with your child. A social story is just like a quick story that you find that really talks about the situation. So for example, if your child was one that hits, the social story would say, hitting is not fun, or we use our hands to clap. that, or no hitting our friends. You know, it's something very specific to whatever situation is going on with the child. So it kind of helps the child relate to the character in the story, even though that child is really the topic of that story, if that makes sense. Another strategy that I would highly recommend is having your child to engage in heavy work. Heavy work is anything that is involving pushing, pulling, lifting, carrying heavy things, or engaging with weighted objects, because that's also gonna provide them with that input that they're seeking. Also, deep pressure activities is gonna be very helpful, so giving them tight hugs, giving them joint compressions or massages, or wrapping them in the blanket and really like pressing on their joints and their muscles. All of that is really gonna help that child to get that input that they're craving without engaging in those inappropriate behaviors. Other things you may wanna try, especially if your child is kind of pressing his head against your head, is you may want to try a scalp massage and see if that'll help your child. You may want to try putting on some headphones and adjusting it so that the earmuffs are really tight against your child, so it provides them with that tight hugging feel. You can also help your child by using vibration. You can help your child by using headbands or tying headbands around their head, which also give that pressure. They also have like weighted caps. This one is not a weighted cap, but they do have caps like this that are actually weighted that you can put on your child's head. They also have like stretchy bands that you could put around your child's head that will provide that deep pressure, or even like those stretchy caps. And so anything that's really providing that tight sensation. Also, weighted vests may be a good choice for them, or those compression garments, which is kind of like Under Armour in a sense, but it goes underneath their clothes. That may also be a good alternative to help your child. So try out some of those activities if your child is one that is constantly seeking that type of force. All right, so question number 4, I'm just gonna say, let me just be honest with you. This was not a frequently asked question, but this was a question that was presented to me, and they requested that I actually make a video about this topic, and I honestly just never got around to making a video about the topic, but I still wanted to address this question because there may be other parents or caregivers out there who have the same question. So the 4th question that I'm going to address is, what are some activities that a child can do if they have what's known as CVI? Now, CVI stands for cortical visual impairment. This means that there may be either a lack of use or a limited use of their vision, and they require certain visual activities to help build up their visual skills, to build up their eye muscles and improve their visual endurance. And so some children with CVI really benefit from things that focus on movement. So, you know, those pinwheels that we used to play with as kids that were like kind of like fans on a stick, and you would blow them and it would spin. So kids with CVI may actually benefit from toys like that. They may benefit from other types of moving things, such as a balloon that's kind of swaying in front of their face, or a balloon that you're kind of hitting around them so they can kind of try to focus and try to track it. Some other strategies that you may want to consider if your child has CVI is to reduce visual clutter. You may also want to consider presenting objects in the same manner. For example, if you're trying to get your child to focus on, let's say, a bowl of fruit, right, or an orange in a bowl, you may want to have that orange in a bowl in the exact same place every day, and work on your child being familiar with where that bowl is, where that orange is, and the exact same setup. Because a lot of children with CVI, it takes repetition in order to build up that visual skill for them. Another tip you may want to consider is using highly saturated colors. So colors like red or colors like yellow. These are actually very beneficial for kids that have CVI because it helps them to focus more on those vibrant colors. Also, light is very important. So doing activities that involve flashlights is going to be very helpful for these children as well. So what are some examples of activities that you can do with your child if they have CVI? Well, one activity that you can do is play with the flashlight and have the child to try to focus on the objects that you highlight with the flashlight. Another activity that you could do is get a silver bowl, you know, kind of like those mixing bowls where you can kind of see your reflection, and put like a bright object in the middle. So maybe a ball, a bright red ball, for example, and roll that ball around in the bowl and have your child to look in the bowl at the rolling ball. And not only is this helping them to try to focus on that red object, that's also teaching them to kind of focus on their reflection that they're seeing in that bowl. Another activity that you can try is getting a black poster or a black trifold board and putting something really bright in front of it. So like a bright red slinky or some bright red or yellow beads in front of it, because that black with that highly red or highly yellow color is providing them with that visual contrast, which is also going to help with those visual skills for them. So one final activity that you can try is doing an activity with those LED finger lights. Having your child either to wear those finger lights, or you can wear those finger lights and draw the attention on certain things around the room and see if your child can focus on those things. So I hope that was helpful. I just really wanted to address that question in case other parents have the same one, but those are just some ideas, strategies, and activities for children who are having what's known as cortical visual impairment. And last but not least, as far as the parent questions goes, one of the most popular questions that I received, and it's also to this date one of my most popular videos, is hand flapping versus autism, and what exactly it means if your child is hand flapping. Now, if you don't know what that is, I just did it. Basically, it's when your child flaps their hands. It could be for a variety of reasons. It could be because they're really excited. It could be because they're really happy. It could be because they're overloaded or overwhelmed or anxious about a certain situation. So there could be a big variety of reasons why your child is hand flapping. Now, it is known commonly that sometimes children that have autism also engage in those hand flapping behaviors. And a lot of the times it's because a lot of children with autism also have issues with that communication piece, and so they do things with their body to express their emotions or express how they're feeling. And so it is typical for children like 3 and under to engage in those type of behaviors, but if your child is a little bit older, or if your child is engaging in the hand flapping and you're seeing other signs of autism, then you may want to have that checked out. But if everything else is pretty typical for your child, but they do this from time to time, it does not automatically mean they have autism. And like I said, this was probably one of my top videos of the year so far, and so I'm definitely going to link that video in the description below as well, so that you can watch that video in full, and I go into a lot more detail about hand flapping in autism. All right, so we're gonna switch gears, and now we're going to talk about the questions that I received from some fellow occupational therapists or individuals who are interested in occupational therapy. So one of the most common questions that I received from fellow OTs was, would I recommend a new graduate to work in early intervention? And so this is a huge question because there is some controversy when it comes to this question, and I understand why. So I'm going to give you my opinion on this. My opinion is, if you are a new grad and you truly want to go into early intervention, I think you can absolutely do it. I am never the one to say you can't do this, or you shouldn't do this, or this won't work for you, because hey, what God has for you is for you, and so just because it didn't work for somebody else doesn't mean it won't work for you. Like, I know of some therapists who started out as new grads in early intervention, and they're still there 7-10 years later, and they really enjoy it. And so I will give you some tips, however, if this is something you truly want to do. I will recommend that you shadow an OT who is working in early intervention already, so that you can kind of just get a better sense and a vibe for how it feels to actually do therapy in someone's home versus in like a clinic or school or a hospital setting. I would also recommend that you have some type of experience working with children. So it doesn't necessarily have to be as a therapist, because obviously if you're a new grad, you may not be working at all right now. But for sure, I would say get some experience working with children. It could be signing up for a volunteer program where kids are involved. It could be working at a local daycare center. It could be working with an after-school program. It could be working with the park district and finding a program that highlights working with children, and just get involved in that so you can at least start to get a sense of what it feels like to just be surrounded by kids all day, right? So that is my second recommendation. My third recommendation is definitely to find a good mentor, especially if you are gonna go full throttle independent. Now, there are some new grads who take a clinical job or school job and they do EI on the side, and that's another recommendation that I would have, especially if you're still like not quite sure if this is something you want to do or would be comfortable with doing. I would say definitely maybe work somewhere else, but you can also do early intervention on the side. Maybe pick up 1 or 2 clients on the side while you're doing your other part-time or full-time job, and you can kind of fill it out and see, test the waters if you really like it before you dive head first. So I would say take those suggestions into consideration if you're considering working in early intervention as a new grad. You don't have to go all in and just do a full-time EI caseload starting out, but hey, if that's something you choose to do, I say do it, but make sure you have somebody that you can connect with and collaborate with if necessary. All right, so the next question that I received was, what are some good courses or trainings that I would recommend that you take if you're interested in working with the pediatric population? And that is a very, very good question, because there are tons of trainings out there and courses out there that are very good if you're interested in working in peds, or if you're already a COTA or an OT and you're trying to get some CEUs to better your career. And so I brought out a few little props because I couldn't remember everything, but I will highlight some of the things that I have taken as well as some things that I'm interested in taking. And so one website that I take a lot of my courses on is called PESI. I'm not sure if you're familiar with it, but I will definitely leave a link to that website below. And PESI offers some really good courses, and I've taken a lot of their courses over the years. So I'm just gonna I'm looking down at some of the courses I've taken. So I'm gonna highlight and show you or tell you some of the ones that I've taken. And so one of the courses that I've taken from PESI is called Oppositional, Defiant, and Disruptive Children and Adolescents. Now this is for when I was working in like a clinical setting, and I was working with children that were a little bit older, but that was one course that I took. 1, 2, 3 Magic is another course through PESI that I took, and this was all about providing like a 3-step discipline plan to help with children who, you know, just need some redirection with their behaviors, and it was teaching how to help parents have a more effective manner with disciplining their children, and that could be very helpful with all ages of children that you're working with. I also took this. Now this course was very, very good. The OT that taught this course, her name is Dr. Varlisha Gibbs. I really like her courses, and she did like a 2-day intensive course, and it was all about self-regulation techniques. It was about neuroscience, and she really dived deep on talking about how to help children with these techniques if the child has autism, ADHD, and sensory disorders. This was a really, really good course. I don't really know, to be honest, how often she offers it, but if you come across it, it was another PESI course. I would highly recommend you take that one as well. I also took another course. This one was actually through Summit, which is another CEU platform that I can link. And this one was called Integrating Sensory and Motor Learning. This was another very good course that I took. This was by actually a local OT that works in the same state as me. She is an early intervention provider as well, so that was a really good course. I also took this course. This one was through Education Resources, and it's called, is it sensory or is it behavior? And it was talking about assessment and intervention tools for OTs, PTs, and speech therapists. This one I took was through Vine Education, and this was called Neuroplasticity for Children. This one was very good as well. This one was called Play with Your Food, Overcoming Food Selectivity and Nutritional Challenges with Children with Autism. This one was through Cross Country Education. And so there's like so many courses out there, so many trainings that I've done. Can I be honest with you? I've been slacking this year on my trainings and my courses. But with that being said, there's a piece of mail that came in yesterday, or actually last week, and there is another course coming out. It is going to be a live interactive webinar if you're interested. It is on Friday, February 3rd, and it's a course that I am interested in taking. This one is called Self-Regulation Interventions for Children and Adolescents, and this one is also through PESI. So PESI has some really, really good courses and trainings if you're interested. And if you're interested in early intervention, this is a book that I have. I haven't finished it because it's kind of like a textbook type of feel. It's not like a quick little easy read, but it does have some really, really good stuff in it, and it's called Early Childhood Occupational Therapy Services for Children Birth to 5. So if you're interested in working with children in that early stage of life, then this will be a good book as well. And so yeah, those are some of the courses and trainings that I've taken, and I'll link some of those websites in the description below. All right, so the next question that I received from another OT was, what are some tips on vestibular play, and when should you include it in treatment? This is a very good question. And so first of all, let's just tackle vestibular, right? Vestibular, when you think of vestibular, you could think of like movement, balance. Like vestibular is kind of like how we know we're moving in space, right? It's tell us if we're moving slow, moving fast, if we're upside down, if we're spinning, like all of those things. And our vestibular sense helps us with our sense of balance, and it also helps us with coordination. It also helps us with our visual skills, and it also helps us with that eye-hand coordination, motor planning, and all of those things, right? And so some examples of vestibular play may be jumping up and down on a trampoline. It may be running back and forth to play tag. It may be crawling through a tunnel. It could be bouncing on like an exercise ball. It could be rolling on a scooter, or swinging at the park, or moving really fast in like a laundry basket, or being swung in a blanket. Like there's so many examples of vestibular play. And so as far as when to include it in treatment, it is one of those things that honestly you can include in most of your treatments because it helps with just so many things. So just think about it. Movement is a big factor for helping individuals to learn. We learn a lot better when we're kind of active versus when we're just stuck sitting for hours, right? It's the same, but even more so with children. Children crave that movement. Children need to move so that they can learn. And so having some type of movement activity in your treatment sessions is going to be crucial. Now, when you really want to target it is when you're working with children who have poor regulation issues. Sometimes that movement, whether it's slow swinging or whether it's rocking, can really help to regulate them and make them calmer and ready to learn and pay attention. Vestibular movement or vestibular play can also help with visual skills or visual coordination, eye eye-hand coordination. So you can even do activities where you're like hitting a balloon back and forth to them, because they're moving, but they're also working on that eye-hand coordination as well. And so you basically want to know exactly what you're addressing with the child and why you're addressing it, and how to incorporate some of that vestibular input in order to help them with that certain skill that they may need help with. And so I say, if you can include movement in your strategies or in your activities for your children, then do it, because it helps with a variety of different things. So I hope that was helpful. I know it was kind of vague because the question wasn't very specific, but I would just highly recommend that vestibular play is one of those things that you can include in most situations. So another question that oh my God, I just realized this light has not been on this whole video. Jesus. Okay. Can't believe I shot this whole video and forgot to turn the light on. Oh my gosh. I've come too far to turn back now. So if you've made it this far in the video, please comment, I saw the light. All right, moving right along. All right, so the next question that I received, I'm actually gonna read it so I won't mess it up or forget it. But the question was, advice for treating kids with autism or upper extremity issues without contradicting or making the symptoms worse. So I'm actually gonna break this question up into like 2 questions. So let's start with advice for treating kids with autism. So I'll start with just saying that autism is such a broad spectrum. So it's not like a one size fits all type of ordeal where you can do this one particular treatment or one particular activity and it's gonna work for every single kid that has autism. And so I would advise for anybody out there who's working with children with autism is to do what we know to do as occupational therapists, and that is to assess them, assess their strengths, and assess the areas that they need help with, and assess the areas that they are not participating in or as functional or as independent in, and really get to the bottom of what deficits are these children having, because one child with autism may be great in one area while another child in autism may be not so great in that same exact area. So it's really difficult to have a treatment plan for every single child with autism, but I will recommend that you truly assess what are the positives about the child. What are the strengths that the child is having? Are they really good at a certain activity? Are they really good with some cognitive skills? Find out what those things are, and then also find out what areas do they need help with? Is it attention? Are they having issues with sensory processing? Are they having issues with those daily routines? And so when you know what those deficits are, then you can start to really pinpoint and have a more client-centered approach to your treatment plans. So I know that answer was kind of vague, but let me know if you have a more specific question about working with children with autism, and then we could dive a little bit deeper. But just generally speaking, just like with any diagnosis, it doesn't really matter what the diagnosis is. We have to know what their areas of dysfunction are, or the areas that they need help in, and that's what we want to address, so that they can participate in the areas that they haven't been successful in. So it could be at school, it could be participation in their daily routines, it could be participation in play with others. So as long as you know what skills you're addressing, then you'll be able to better orient your treatment plan. The second part of that question was, what is some advice for treating individuals who have upper extremity issues without contradicting or making the symptoms worse? And so I will say the same. It could be so many different treatment plans or treatment implementation that you do for individuals that have upper extremity issues, but it definitely depends on what type of upper extremity issue, because there's so many different types out there. So some people or some children that may have upper extremity issues, it could be a range of motion issue. So is the issue that their range of motion is limited? Is the issue that they're only using one side of their body? Is the issue that they're weak in their upper body? Is the issue that they're not weight bearing in their upper extremities? Like, there could be so many different issues going on. And so what you have to do is definitely pinpoint exactly what the issue is with their upper extremities, and then you can kind of tailor your treatment plan to know, like, oh, I can do this, but I shouldn't do this because that could make it worse. And so honestly, it would just depend on what the true exact issue is in order for you to understand what precautions you need to follow and understand what things you shouldn't do so that you don't make their symptoms worse. So just like with the other question, if there is a very specific question tied to that, then I would be happy to address it. But just generally speaking, with anything that you all do as therapists, focus on the skill set, focus on their strengths, focus on their deficit, and focus on the overall purpose, the activity, their occupation that's meaningful to them, and that'll help you pinpoint what your treatment plan should look like. So I hope that was helpful for you all. All right, so that pretty much wraps up this video. It was so much information to cover, but I just wanted to highlight, like I said, some of the most common and popular questions that I received over the years. Moving forward, 2023, we are only a couple weeks away, and so if there's anything that you guys want to see from me in the next year, 2023, let me know in the comments below. Let me know if there's some type of whatever different questions you may have, different types of videos you want to see. If there, whatever comes to mind, I am open to ideas and suggestions, because this channel is not about me, it's about you all. And so I really want to make sure that I am gearing my videos to really help you all and really help cater to whatever needs that you guys may have. So thank you guys for watching, and please subscribe, like, check out those links below if necessary, and until the next time, bye. Stop crinkling stuff, I'm shooting. Oh Lord, this YouTube video is trash.